workout on your back. So I'll start with the T-spine. It says position the patient supine or erect, so you can do it either or do things laying down. Mid-sagittal plane centered. If supine, flex knees and hips, place thighs vertical, and place the patient's back in contact with the tabletop. So if you want to go ahead and bend your knees up, and I think that's just more comfortable for the patient, just because your back has that curve in it. It kind of flattens out the lower, I feel like you notice it as much in the T-spine. It just kind of helps flatten that back out. And if you're back out and if you're having back pain, it just helps with the knees bent up. So center perpendicular central ray, halfway between the jugular notch, xiphoid tip. So that should be the level of T7. Top of the image receptor, 1.5 to 2 inches above the shoulders, 7 by 17. Expose on shallow respiration or suspend at the end of expiration. You can keep those on.
They were falling off.
So I got everything good for I'm on a table bucky, got everything all lined up. Put your arms down at your side for me. So, kind of like bunched up at the top. So you can do it. I feel like on this, you can kind of do a couple things on this. What I kind of like to do on this, just kind of make it easier on me, I kind of put the top of the light, like right there, like right where the Adam's apple would be, or like right below it, right there. That really should place the image receptor about 1.5 to 2 inches above the shoulders. So I kind of put it right there where the Adam's apple would be. So what it kind of said for the centering, I'm gonna press on you real quick. I feel like it might not be as comfortable for the patient, but there's like her xiphoid process right there. There's the xiphoid process right there. So there's the jugular notch, xiphoid process. That should be in the middle of that. It might be a little low when I put it right there. I can move it up just a hair. So I'm still pretty much on our Adam's apple. So jugular notch, xiphoid process, put that right in the middle of there. So you can kind of go about 2 different ways, kind of from the centering aspect of it, and then that, I kind of just make it easier and just kind of put it like right where that Adam's apple would be. If you want to kind of double check, that's fine too. They should turn out pretty much, I kind of moved it just a hair up, but it should pretty much be the same spot right there. I want to collimate just to her, starting to look like a chest. I want to collimate just to her little spine. So I like that. It's at an 8.5. You don't have to memorize that, but for her body, I like that collimation. So for markers, so I always put markers like right here. So I'm not gonna bother like counting or anything, because I mean there's the middle of the image receptor. It's open enough to go this way. If y'all put it right here, repeat, because it's not in the collimated field. So I put it up here at the top right there. That should be kind of where the C-spine is, not in the way of the T-spine. Some people put in the middle. I'm fine with either or on that. Put the shield right here. Go ahead and take a breath in. Blow it all the way out. Hold it out. Expose. And there's T-spine.
It's not suspend respiration.
Suspend at the end of expiration.
Expiration.
Yeah.
Okay.
Yeah.
Because you want this done as blood as possible.
Huh?
You want all the air out.
Yeah. So if I was doing this in a real life situation, if I was doing a T-spine and sacrum Coccyx, I'm not going to turn her over and do the laterals and turn her back to do the APs. I'm going to do them all at the same time. So I'm going to go ahead and do her sacrum while she's sitting here AP, then I'll turn her lateral and do all the laterals. So AP, axial sacrum, so sacrum cephalic, so position the patient supine, center at the mid-sagittal plane of the body, center to the IR, central ray 15 degrees cephalic, entering 2 inches above the pubic symphysis, 10 by 12, and suspend respiration. So I'm going to go ahead and just keep my 14 by, or my big cassette in there. So I'm going to angle 15 degrees cephalic, lower that down to 40. everything up. I'm gonna call make to 10 by 12. Go ahead and extend your legs on this one. I don't feel like you should bring your legs up because it kind of squishes that sacrum coccyx right there. So kind of like what we talked about before, really don't want to feel pubic symphysis. You can feel the ASIS and go 2 inches down from that. So I'm going to find her ASIS. ASIS. Go 2 inches down. Sit on that mid-sagittal plane. Real quick, easier. This has your 8 by 10, 10 by 12 line, so I don't have to like count or anything. So I can put my marker down there in the corner. There's the 10 by 12. Okay. Go ahead and hold your breath. Expose. So 15 degrees cephalic for that one. Coccyx, center mid-sagittal plane, 10 inches caudal, 2 inches superior to the pubic symphysis. So I'm going to do the same thing, just change my angle. So sacrum cephalic, sacrum's bigger, that's 15. Coccyx caudal, CC, 10 degrees caudal. So I'm going to do the same thing. ASIS, 2 inches down, midline. This one says collimate to 8 by 10, just a little bit smaller. So there's my 8 by 10. I'll just move it to that little corner. There you go. Go ahead and hold your breath. Expose. So go ahead and do all the APs while she's in AP. There's no reason to AP lateral, do it all at once. Questions on any of the APs?
Are those usually together in a series?
No, that would be just if someone ordered T-spine and sacrum coccyx, it just kind of random. They would have those two, but yeah. So lateral T-spine, we'll go back to the lateral position, patient on their side. Gonna do left lateral, heart closer, flex the knees and hips if done recumbent. If possible, left lateral close to the hearts. Center over the posterior thorax to the level of T7. Top the image receptor 1.5 inches above the shoulder. If available, place lead rubber behind the thorax to absorb scatter. I could not find any lead rubber, but kind of like what was mentioned in the book, that little square right there, I can put that in the back just because when you turn lateral, you're very thick. It's going to create a lot of scatter. That would help absorb scatter. So you might really see that one done in clinicals. So I'm going to scoot towards me just a hair and roll up on your left side. Get your shoulder on top of your shoulder, hip on hip. So patient's going to do what they're going to do. Y'all see, she's a little, she's straight, but she's going at an angle right there. Her shoulder on top of shoulder, her hips on hips, knees on knees, but she's kind of going like this. Go ahead and scoot your hips towards that wall for me. Scoot your hips forward just a little more. Yeah. Okay. I usually kind of like that, just make sure nice and straight. So we haven't really done anything laying down on the side before. Big thing on this, positions are easy. I just want to make sure she's straight. Like I talked about in the book, I mean, if she's like that, I mean, things aren't going to be on top of each other. She's not in a true lateral. If her hips are, you know, so I want to make sure everything's nice and straight, back nice and straight. Go ahead and put your hands up like this, a little bit higher for me. Good. Just so they're all out of the way. So I'll always do shoulder on top of shoulder, hips on top of hips. By 17. So on this one, I can feel the back of her, there's the bottom of her scapula right there. So here's mid-sagittal plane on her body right there. So what I usually do is, it says the posterior thorax, what I do is like go an inch back from that to be on her posterior thorax right there. So if you do see like where I am right now, that should be about 1.5 inches. Bring this shoulder down just a bit. Yeah, good. That should be. I think I'm gonna, just for safe measures, bring that up just a hair because I felt like it was cutting kind of close right there. But I mean, this is still gonna be in her spine right there, or C-spine. So I go from mid-sagittal plane. I go about 1 inch back on the posterior thorax. Collimate in, and then if I do have room on the table, I can just put that right there. If not, if you don't, we can just put that right there.
It's pretty wild putting it on the table. For some reason, it looks like you shouldn't.
Oh, yeah,
But
just doing
it works.
Yeah. So I did it at T7. I kind of looked. I was it's a little tight. I moved it up just a hair, but I'm basically at the bottom of her scapula still. So I kind of go from the scapula, go back. I kind of just look at that. If I feel like I need to adjust it a bit, I can. So go ahead and breathe normally on this one. Expose, long exposure time on this one. So breathing technique, what are the ribs, all that.
Is it 1 inch back from coronal?
Mm-hmm. Yeah, I'm sorry, I think that's in hexagonal.
This was the loud one.
Mm-hmm.
When we comp for this, or we just tell the patient breathe in and out, shallow breaths.
I would say just breathe normally,
Okay.
because you kind of told them on the other ones to take breath, so go ahead and breathe normally. It's going to be a longer exposure.
Right.
Go ahead and scoot down.
And they
the
start
table
breathing
before you
manually.
eat.
Oops,
Start
sorry.
Yeah.
Definitely don't want to kick that off. But there's more for this.
That's good, that's good. So the swimmers, we use this on the C-spine when we don't see the top of T1, and then we usually do the swimmers on the T-spine just because y'all saw in those images, you see like T3 really well, just whoever you are, the shoulders are big, they're gonna be in the way, do a swimmers, you'll see the top of the T-spine better. So elevate the arm that's closest to the IR, flex the elbow and rest the forearm on the patient's head, depress the shoulder that's farthest away. It says move it anteriorly or posterior out of the way. I do keep everything straight and not do that because I feel like it twists you. So I'm going to keep everything straight. Adjust the head, lateral position, mid-sagittal plane parallel. Adjust the height of the IR so it's centered with the interspace of C7, T1. Direct the central ray to the center of the IR, perpendicular if the shoulders depressed for 5-degree caudal angle if it's not fully depressed. I told you this, and we're going to do it this way in lab. I do always put a little 5-degree angle on it because I do feel like it helps open up that joint space a little bit more. Do what?
Which way?
Caudal. So go ahead and put this arm down like you're reaching for your feet. So that's what I usually kind of, you can bend your knees just to get you stable. Go ahead and put your arm down like you're reaching for your feet. Go ahead and put this arm right underneath your head like you're swimming. Good. So on this one, and I still want to make sure she's nice and straight. Shoulder on top of shoulder, hips on top of hips. So this is what I mentioned in class, super easy. Boom, just where her neck meets where her shoulder, right there. So I'm going to center right there. So shoulder, boom, meets the neck right there. where I'm gonna center. I have it open, I'm gonna keep it open to 10 by 12. Keep that open. I'll put my left marker here in the light, right there. Go ahead and breathe normal on this one. This breathing technique on this one exposed.
Is that it?
No, we gotta do lateral sacrum Coccyx.
Okay. Awesome.
So this one, C7, T1, joint interspace, joint space. So boom, just fall it down where the neck meets the shoulder, right there. Arm down. Just kind of tell the patient like they're grabbing for their feet, just to make sure that's really depressed. Arm up like here, like they're swimming. This is swimmers. Also do that standing up if you need to, if you can't get the C-spine. You can relax your arms if you need to. Here's your pillow back. I do kind of move the pillow out of the way on this one. It really shouldn't get in the way on this one, but just over the arm.
It's not radiolucent enough?
Yeah, I mean, it'll kind of show, I mean, it is, it'll go through it, but you'll kind of see all these, if there's,
Okay.
you know,
Pretty
so,
close.
yeah, so I just try to move out of the way if I can. For the last two, so lateral sacrum, position patient lateral, hips and knees flex, adjust the long axis of the spine so it's horizontal, center of coronal plane passing 3.5 inches posterior to the level of the ASIS, perpendicular central ray, place lid rubber if you can. Okay, go ahead and go. So shoulder on top of shoulder, kind of move your arm up, yeah. Shoulder on top of shoulder, hip on hip, nice and straight, knees bent. Especially having the knees bent, I really can't, I mean, she moves a little bit, but if her knees aren't bent, I could easily like push her over. If her legs are all straight, she can move really easily. So shoulder on top of shoulder, hips on top of hips, nice and straight. So on this one, so I'm gonna kind of feel the crest. I'll go forward. Clock line for ASIS. ASIS, so I'm gonna go 1, 2, 3.5 inches back, right there. So there's gonna be my lateral sacrum right there. From that, lateral sacrum is 3.5 inches posterior to the ASIS, Coccyx 3.5 inches posterior, and 2 inches down. I'll make that to a 8 by 10. I always put, when I'm doing like laterals down here, that spine goes like this. So I always put markers in front on this one because that spine kind of goes like that. So I put marker in front right there. Hold your breath on these. So 3 for the T-spine, AP lateral swimmers, 4 for the sacrum coccyx, AP, and AP for the AP, 2 APs for the sacrum coccyx, 2 laterals, sacrum coccyx. Questions about any of them?
I think
So really, if you do the sacrum,